right, good afternoon, everyone. My name is Delilah Ofosu-Barco, and for those of you that don't know, I'm the Corporate Manager for Research Operations and Research Project Management here at the Institute for Better Health. I'd like to welcome you guys to our June IBH speaker series and introduce today's speaker. Unfortunately, Dr. Miro Baka-Shannon, the co-presenter for today's speaker series, is unable to join us today, but joining us today is Bonnie Scott, and I have the pleasure of introducing Bonnie to you guys. Bonnie's passionate about using human-centered design, research, and innovation to tackle complex problems at the intersection of health, technology, and society. As the Research and Innovation Officer at the Mississauga LHIN since 2018, Bonnie has led highly collaborative and cross-functional healthcare projects that have resulted in an organizational research framework and a toolkit, internal cultural change towards towards a culture of continuous learning and improvement, and new opportunities for research and innovation at the regional level. Prior to this role, Bonnie worked at the Canadian Partnership Against Cancer and the award-winning service design firm Bridgeable. In these roles, Bonnie worked on projects with healthcare partners and organizations from across North America and Europe, connecting human insight with service innovation and organizational growth and change. She brings unique expertise to her work as a PhD level scientist, biomedical designer, and a healthcare innovation leader. Bonnie received her PhD in cell molecular biology from the University of Chicago and a Master's of Science in Biomedical Communications from U of T, one of only 4 accredited medical illustration programs in North America. Please join me in welcoming Bonnie.
Thank you, Delilah. So how's everyone doing today?
Great.
Good? I feel like there's a bit of an excitement in the air. It's the last day of school. Right? Who has kids in school? Yeah? Okay, a few of you. So I feel like this is a bit of a big milestone like that for me as well, because I've been at the LHIN since last June. And so now it's been about a year. And I feel like I really reached this really great milestone of developing with Delilah and others and a lot of the research champions at the Mississauga LHIN, a research framework and the workbook and toolkit. So I'm really excited to be sharing with those documents with you today and walk you through our journey of where we started last year and where we are today. So before we get started, I just want to have you guys turn to your neighbor and introduce yourselves if you don't already know each other, and think about, what is your why? Why are you interested in research? What role are you playing right now in research? So just take a minute, turn to your neighbors, and just have a quick conversation. Okay, so I'm going to ask you guys to finish up your quick conversation, and I'm going to ask you guys, what were some of your why statements? Yes, Delilah.
So for me, I have a personal connection, and myself in life have benefited from research and I want to be able to pay that forward and contribute to enabling research. That's my why.
So paying it forward, really that mission-driven kind of perspective. Anyone else? Yes.
So I'm a clinician.
Okay.
We're going to do evidence-based care. We need evidence.
Wonderful. So evidence-based care. So really thinking about how do we do research in that clinical setting. Who else wants to share? Yes.
So my interest was really around how you can action the results of research. So you can take that information and that evidence, and then you can figure out, well, how do I actually use it to make a change?
Right, so really thinking of it as like the basis and the foundation for decision making. And I think that's where the LHIN was about a year ago, and maybe a little bit before that. So how many of you know what the Mississauga LHIN is? Oh wow, I'm actually pretty impressed. Because, so when I started last June, I must say, I didn't really know what the LHIN was very well. I think for a lot of people, general citizens, still don't know what the LHINs do very well. And so when I started, there was a lot of educating my friends, my family, what I actually was doing at this organization called the Local Health Integration Network. So thank you for sharing your whys, and so I'll share a little bit with you while I just set up what the LHINs are. I'll tell you a little bit about our why story. So the LHINs were established in 2005, and initially there were 14 LHINs based on geography, and they were put in charge of being stewards of the regional healthcare system. And so what they were really doing was looking at planning, funding, integrating, and delivery of healthcare services within a regional geography. And so the plan was really setting that vision for where we could go as a regional healthcare system. Funding was really funneling the dollars from the ministry to regional healthcare services. Integrating was trying to think about different programs and other ways that we could actually bring the different services together to create more of a continuum of care or coordinated care delivery. And then the delivery component was when we merged in 2017 with the CCACs, which were in charge of home and community care. We really then started to play a role in direct patient care delivery. And so those were the 4 areas in which the LHIN was responsible. And so the Mississauga Halton LHIN, being one of the smallest LHINs, so maybe you saw on the map at the beginning, the only smaller LHIN is really the Toronto Central LHIN, which is Toronto proper as a city. So the Mississauga Halton LHIN comprises of Halton Hills, Milton, Oakville, Northwest Mississauga, Southwest Mississauga, East Mississauga, and South Etobicoke. So Mississauga, Halton, Milton, Oakville, and a little bit of Etobicoke. So there's 7 what we call subregions within Mississauga Halton. And in those different subregions, in total we have about 1.2 million people. So that's actually a lot of people to be managing all of the healthcare for. So in that region we have a great diversity of people. We have you can see the top 5 languages spoken in our LHIN. Obviously we have English, but we have a lot of other languages. We have Urdu, Arabic, and others. And we have probably one of the highest number of new immigrants within our geography compared to the other LHINs. And so when we think about regional healthcare planning and delivery of services, we really need to be taking these things into perspective when we think about what are the things that we need to focus on as a regional steward of the healthcare system. And so within our LHIN, we know that there's increasing seniors population. We know that we have a large number of new immigrants. And we have a lot of chronic and complex diseases, of course, that a lot of other LHINs are having to deal with as well, but we have residents that have a lot of these issues. And so with that, so in terms of the different organizations that we oversee the 2 hospital corporations, so that's Trillium Health Partners and Halton Healthcare, and those span 6 different sites. We oversee 28 long-term care homes, 10 mental health and addiction service providers, 32 community support service providers, and 1 community health center. And what you can tell, even by just showing you that we have 1 community health center, we are very under-serviced in terms of our primary health care delivery. So team-based primary health delivery within our LHIN. And so that was definitely an area that we wanted to focus on in our LHIN. And so the role of the LHINs have evolved over the years since 2005. So there has been a number of different legislation that's been passed to change the accountabilities and the responsibilities of LHINs. Most recently in 2017, we did merge with the Community Care Access Centers, so the CCACs, who delivered home and community care. Most recently though, you probably are well aware that in April 2019, the Bill 74, the People's Health Care Act, was passed into law. And that act actually merged together the 14 different LHINs under a super agency. And not only was it the LHINs, it was also Cancer Care Ontario, Health Quality Ontario, eHealth, and a number of other groups. So that was actually a big shift for the LHINs. So there hasn't been an official transition yet, but the LHIN, in terms of its different functions, being home care delivery, for example, that might end up under an Ontario Health Team, for example, where some of the other functions of regional planning, for example, programs, and other functions might actually remain sitting under that super agency of Ontario Health. So there's a lot of change afoot. And so in June 2018, so last June, when I started. I remember getting to the LHIN, and I think a week into being at the LHIN, the coffee machine was carted out. And I was like, what's going on? We can't have coffee? And it was just, we actually rented our coffee machine. I'm not sure how many of you guys rent coffee machines. No, I thought it was a little bit strange as well. But apparently the organization, renting it to us said, okay, well, we're gonna take our unit back, and no one was providing coffee anymore. So yeah, anyway, it was a little bit of an interesting time. So June 2018, that's when the new provincial government came into power. And that started a lot of transformation in the Ontario healthcare system. But I think what's really important to keep in mind is that despite these system changes, what we do remains the same. We still want to deliver excellent care to patients. We still want to coordinate and integrate care. There's a lot of really important and fundamental things about healthcare delivery that still remains the same, right? And so the need around generating evidence through research for better decision making at all levels of the healthcare system is still, it stays the same, right? So regardless of what future is in store for the LHINs or what else comes to pass, there's still this really critical need around research, right? And with different leadership and different provincial powers, things sort of ebb and flow in terms of resources and funding and things like that. But at the core of it, we still really need research. Research is still really key as an improvement practice within healthcare. And probably because you have a lot of people working on integrated healthcare systems and rapid learning health systems, this is bread and butter to you. But I think the vision for where we're going with the healthcare system is this model of a rapid learning healthcare system. How do we actually integrate continuous learning and the research process within the clinic, within how we do work every day? And so this is how we really want to start to evolve our model of doing healthcare, is how do we embed research within the daily practices of the healthcare system? And this goes to Anna's point around how do we actually then take research knowledge and then integrate it into action. So we're going to go back in time a little bit. So I kind of sped up to the present, and now I'm going to go back in time. So back in 2017, so before I got there, the Mississauga Health and LHIN recruited a very innovative clinical leader. Some of you may know her by the name of Dr. Mira Baho-Shannon, so she unfortunately couldn't be here today, but does send her regrets and would have loved to have been here to share her knowledge with you. But she in and of itself was really passionate about this idea of research and the promise research could have in helping the LHIN do better decision making. So a lot of times we think of research being either done at a hospital or at an academic center, or maybe a function within the ministry, but no one had really formalized that within the LHIN or a regional healthcare agency. So this was actually pretty powerful and kind of new. So she decided that before she even accepted her role at the LHIN, she wanted there to be an agreement that they would create a research and innovation officer role. So that was kind of neat, right? So she said, we need to put our money where our mouth is and actually say, we're gonna get someone on staff who will be focused on research and innovation, and that's their only job. So she advocated for this investment in research back in 2017. And so she started to propel this call to action at the LHIN around to really improve healthcare. We need better evidence for decision making. And this isn't just having a decision support team who pulls data from the different healthcare providers and creates graphs and charts. It's something very different, right? So we need to actually enable this. And to do that, we need to invest in research that's strategically aligned and high quality with the LHIN. And so where were we at the time? So the Mississauga Health and LHIN, which had been around maybe 30, 40 people before the merger with CCAC, started to really shift in its focus, right? So CCAC was a group of around 600 people, merging with a group around 40, right? So very interesting merger as it happened. And the CCAC actually had been doing research for quite some time. And how they were doing it was actually in partnership with academic researchers because they were a site of direct patient care. So a lot of academic researchers said, hey, we have this new idea. We really want a site to test our idea at. You have clinicians, you have patients. We really want to be working with you. So they had already a process and a certain way of working with researchers. The LHIN, on the other hand, was, because it was at that level of the healthcare system, where it was more of a connector role, a facilitator role for researchers, gaining access to networks and different aspects of the healthcare system, they tended to play less of a participation role and maybe a direct site of research, but they would facilitate research by writing letters of support, helping create collaborations for research. But when those two organizations merged, this meant that the scope of research that the LHIN could undertake is actually quite different, right? And also, Mira had this vision around health systems and services research and population health research, which I know is a focus with your research team here. And so really leveraging that position within the healthcare system to do a different type of research than maybe had been done with the former CCAC. And so our new partners, if you will, so we had traditional academic researchers that had been collaborated with before, but now we could start to tap into our community health system, so our clinicians, physicians, so both in family health teams, solo primary care practices, and also other community health providers that we had already had established relationships with. The other really interesting group that we could start to involve in research was our staff. So as a researcher, some of the best research questions that you develop are the ones that you have direct knowledge of, right? So if you have personal experience in a particular area, you really know what the gaps are, right, or the challenges. And you can start to develop research questions around that are really, really strong and really interesting because you're really immersed in that world. And so we thought when we look at our staff, they're involved in a lot of different regional program planning, contract development, accountability agreements. There's a lot of areas that when you think about health systems research, there's a lot of opportunity there for them to be partnering or even sometimes generating the question for research around health systems and population health research. So we thought they would be a really interesting group to arm with some of these tools around research. And also patients. We can't forget that patients are becoming more and more activated and more involved in research processes. Where's Christine? Yes, so I think you're involving patients, right, in the research process and getting that started here. So that is a real focus now for a lot of research. So we have our own patient family advisory committee. We have done a lot of work with our community engagement group. So there's a lot of interesting ways that we can start to involve patients from the LHIN's perspective within research. And so this is just to emphasize that we want to encourage people across the healthcare system to see the value in research and bring their perspective to bear on the research process. And so I put this up here in terms of funding sources at the top. Typically we think of there being sort of this gatekeeper role of academic institutes or other organizations that sort of hold funds and help support researchers in their work. And these being the researchers that we're now looking at fostering to do health systems and population health research. But I think it was these new groups that we really wanted to start to focus on. And so we focused on 4 principles in our research investment. So we thought about leadership, we thought about partnerships, what partnerships can we start to develop, the culture around research at the LHIN, and what are some of the processes and resources that we need to develop to do research. And we also started to put forward a really bold vision of what we wanted to do. So last year was a really big year around our strategic plan development. So the LHIN reached out to hundreds of organizations to get input on what our 6-year strategy would be. Typically, the LHIN has been required from the ministry to put forward a 3-year strategic plan. this was the first time that we were going to break the mold and actually do a 6-year strategic plan. And within that, there was, out of the 4 pillars that were our new strategic directions, one of them was accelerating innovative practices. And so research, we felt, was as a foundational part of innovation and sort of leading sort of change and improvement. We said, okay, let's sort of put a stake in the ground. So after these 6 years in 2025, we want to be seen as leaders in the Mississauga-Halton area around health system and population health research in Ontario. And so why would you might think Mississauga-Halton could be a leader in this area? It's on the screen, but just kind of think. So some of the key factors that I told you about that make the Mississauga-Halton region unique. It's kind of small, has a very large population, it's very diverse. So if you're a researcher and you're looking to study something in a particular population, we might have that population for you, right? Also, we have really good partnerships in the healthcare system. And so we thought as a LHIN, we could really leverage those within our particular LHIN to be a leader in research. But we know that there are other people playing in this space and we're like, you know, we want to be a little bit provocative, so let's just put it out there. And so we also, when we were starting to think of how we're going to tackle research at the LHIN, we also wanted to start to develop some simple messaging around communicating what we were doing. And we developed this slide, and I've used it over and over again because it's really helped us to start to create a framework around how does research play with some of these other very well-known improvement practices. And I'm going to lump them under this broad umbrella of improvement. Some people have an allergic reaction to that word when we use it in context of, let's say, research or innovation, because research can maybe sometimes be agnostic of, you know, what kind of outcome you're looking to achieve potentially, and innovation, you know, well, that's definitely not improvement, that's something very different. So, you know, aside from some of the nitpicky sort of ways in which we define these words, I'm talking about improvement being the overall, let's improve the health system kind of improvement. And so when we think about the different types of improvement practices that we typically do in healthcare, we do research, we also do quality improvement, we do program evaluation, and we also like to say we do innovation. Probably not what people outside healthcare might consider innovation, but we say we're pretty innovative, right? There are some things that we would say are innovative. So in terms of research, we really tried to create this simplistic kind of way to sort of frame it so that we weren't stepping on people's toes. We weren't saying we're trying to take over what you're doing. We think that research has a really important and clear and separate role within these different types of practices to create new and generalizable knowledge. And that has been a really key piece as we've been going forward with our leadership as well as our staff to try and explain how is research different from some of these other improvement practices. And I can tell you, when I first started this, I was like, oh, everyone's gonna know what research is, right? It was a very confusing term, right? Especially when you start to bring in these other practices. It was really important from a leadership perspective to get people on board and to start to champion what you're doing, to really clarify what it is that we are trying to do. What is research? It's something new. It's creating new and generalizable knowledge, right? So it's not something that is quality improvement or one of these other areas. So we also tried to create different ways to show what it is. So I put this together because I'm very visual, and I was like, what is a sort of a timeline that you can sort of show on how these different processes or practices might interact? So you can imagine that you have something like a process or service or program. And quality improvement is sort of exemplified by these sort of PDSA cycles, these rapid cycles of improvement, right? So you can think of it as these little chunks in time. You're doing these PDSA cycles, and you could be making an existing process better by using these rapid iterative cycles of change. But then you might come up to a point in your QI project and say, hey, we need to ask this question that no one's really asked before. And we might actually want to generalize that across the system and say, this is something that we need to do differently or better. So you might start to generate a research question after this QI cycle. And you might want to rigorously test the hypothesis, from that QI project. Or it can come out from outside of whatever project that you're doing. You might just randomly have an observation, something happening in the healthcare system or otherwise, and say, hey, there's something really interesting here that I want to observe, test, and do a research project around. After you do research, you can follow that by more quality improvement. And then at the end, you might have a program evaluation to say, did we actually meet the targets or the metrics that we were intending to achieve with this? So thinking of, obviously, you would want to set up what that evaluation framework is at the beginning, but it's something that you do at the end where you're like, okay, let's just see how we did. And then innovation can sit a little bit outside of that, where you use research to inform your knowledge and where we are at in the system, but it really does try to push the boundaries of what we're thinking and try something new, right? So, and it's not only having a great creative idea, it's also about having that idea get adopted in the environment. And so CIHR sort of buckets health research into these 4 areas. And I've liked this framework because it helps explain where we're deciding to focus on. And so there's biomedical research, which, you know, I did my PhD in, you know, I think most of you know what that is. Clinical research, which, you know, involves randomized clinical trials and things like that. But then there's these 2 other areas that we thought were really important to start to drive health system change from that regional health system level. So population health research, looking at discrete populations with maybe similar characteristics, but then what can we do to improve the health of those populations? And also health services and systems research. I'm always a little bit confused actually what people tend to go with as a term. Is it health systems research, or do they just lump it all together? Health services research? Okay, so maybe I'll use that in the future. But yeah, so, and that's again looking at a problem from many different perspectives from within the healthcare system, looking at policy, looking at clinical perspectives, but also looking at planners and just the whole range of different things that impact a particular problem, not just on the clinical perspective or at the more detailed biomedical level. And we knew that many collaborations within our organization would be needed to start to think about research. And so these are just some of the functions in our organization, but really thinking about how do we get decision support on board. We know that a lot of people approach our organization around research to get data, right? They have a research project, they need some data to do their analysis, they contact us to and get connected to our decision support team to then get that data and do their analysis. But sometimes they're very disconnected from the rest of the organization. So for example, someone like myself, then I would love to know what the decision support team is actually giving out in terms of data and what types of research projects we're supporting. Strategy, of course, is really important to think about how is the research project aligning to our strategic vision for the organization. Integrated care, how do we actually align on certain projects that are more in the integrated care space, because that's definitely one of our areas of focus. Patient family advisors, again, really important. So thinking through all those different functions within our organization that are critical for research. And then again, really thinking through how are patients and family advisors involved. And of course, external partnerships, very critical requests that we're coming into the organization in a more formalized way and do due diligence in terms of making sure that they're being conducted in a proper way. So this is a little bit of a timeline in terms of what happened. So initially, I was brought on, and I shouldn't say it was just me at the beginning. There was actually another research and innovation officer who was around for about 2 months, and then she went on maternity leave. So I ended up stepping in the role kind of early on, but she had actually already started a lot of great work with the Institute for Better Health team and researchers in our region to move some of that work forward. So I don't want to discount that. So having the research and innovation officer role was really important to start moving the work forward. And then as we were going on, we were developing this collaboration with the Institute for Better Health, and I think what was really helpful in that area was Mira had a lot of great connections with the team here, so she knew Dr. Robert Reed very well. So that really helped move that collaboration forward. Also, once we started to develop the alignment from a leadership level, so early on I did a lot of presentations to the leadership team. Just to explain, why was I there? What was I trying to do? What was Mira's vision for research at the LHIN? Then we could actually start to put in place some of the more work streams that were critical to some of the work that I'll share with you today. One of them was the research committee, and we ended up having monthly meetings, an hour and a half monthly meetings where we actually reviewed research requests, talked about some of the activities that were going on, and tried to move just the thinking around research forward and address any issues that were coming up. The other thing was the research champion group, and this actually came from our privacy and ethics officer, which was kind of cool. There were some other groups at the time that were being called champion groups. So we had a culture champion group that was being established to help disseminate our values that were being launched along with our strategic plan. And so we had a culture champion group. Mark Radner, who is our privacy and ethics ombudsperson, he also knew of a different champion group. And he's like, maybe we can just do, some like a group of champions around research. Wouldn't that be great? I was like, that is brilliant. So, and not to be competitive, but we actually had 3 times the number of champions in our group versus the culture champions group. So, just want to say, research was very popular amongst the organization. So we ended up establishing a curriculum, a 6-month curriculum for the Research Champions group, and we held monthly meetings. And it was a bit ambitious at the beginning. We decided, based on what the learnings from the Culture Champions group, we decided to do a 3-hour monthly meeting. And based on my background, I was very familiar with leading co-creation workshops and things like that. So I styled the meetings very similarly to a co-creation workshop. So I'll just go back and just focus on some of the areas in turn. But let's just talk about the leadership area. And so again, Mira's vision was to have someone as the research and innovation officer. So I came on last June. And as Delilah said, my background is in molecular and cell biology. I have a PhD in that area of research. And then I really was passionate about communicating science and health issues. And so that led me to, even though I was very done with school after my PhD, I actually did a master's in biomedical communications. Because I thought if someone was actually going to hire me to communicate about science and health, I need to have some training and actually design and how to actually do that. So I did go back to school to learn about that. And then after that, I worked in a consultancy for about 5 years around service design and how to actually bring health and science issues to the forefront with healthcare organizations like hospitals and others. And so this seemed like a natural fit to sort of talk about, okay, thank you, to talk about how can we actually start to embed research into the organization. And so I started that communication piece with the leadership and developed alignment early on. But it was really around how to start to develop the systems and processes and culture in the organization to move research forward. So I'll just end it there. So around partnerships, I mentioned the collaboration with the Institute for Better Health. And so it's not just about how do we tap into some of the supports and services that the team can offer, but it was also around how do we actually open up the collaborations around research. So we know that you have a wonderful team, people who are on the clinical side, people who are on the more academic side. We're really starting to be able to tap into that knowledge capital and those resources, in addition to how to navigate the research process as well. And just to mention that Delilah is on our research committee, and so is Rob. So that has really furthered that along as well. So around the culture piece. So this was, I think, one of the biggest highlights of the past year for me. So at the beginning, when Mark Ratner, as I mentioned, said, hey, create a research champion group, I was like, okay, that sounds interesting, but is it really going to be successful? Not really sure. It sounds like, people might just be, tired of all these different groups and And so we'll see. So to really pick people who were enthusiastic, we actually asked people to submit an application. So back in September, I sent an email to the whole organization, and again, this is like over 600 people. And I said, fill out this application, let us know your why, right? Why are you interested in research? Why do you want to be part of this group? And we got some amazing answers. And so we distilled some of the qualities of that we were looking for in a champion into these 5 different areas. We wanted them to be systems thinkers, to be able to see the big picture. We also wanted them to be open, curious, and inquisitive. We wanted them to be data-oriented, objective, and methodical, approachable, supportive, be the go-to person as a champion, being the leader around research within the organization, but also maybe be someone who sees needs around research every day. So people who are frontline workers in the healthcare system. And so in terms of the goal for the research champions, we wanted them to be equipped with the knowledge and processes to be able to support research within the organization and be those go-to people for people with questions who wanted to be engaged around research within the organization, and even potentially review research requests in an ad hoc way. We just wanted to give them the experience of actually being participants in the research process. So we ended up with 34 people in our research champions group, a very large group, made up of, I think a third of the group is actually frontline people in the healthcare system, so care coordinators. We had a family physician, we had a nurse practitioner. It's a whole wide range of people. We had people from the quality and risk team, we had people from information technology team, we had people from regional programs, all over the organization. It was such a fabulous and cross-functional group. And these were some of the reasons why they wanted to be involved. So they wanted to explore new ways of delivering healthcare. So how does research fit into the big picture? They wanted to challenge themselves. They wanted to have a positive impact. So there were also people who actually had professional degrees in data analytics, for example. So it was very, very interesting. People with a lot of really great insights already. And so we developed this 6-month curriculum. And each meeting had a theme. And then there are 3 core areas to focus on. I think the next slide actually talks about that. So each meeting had a learning component, a co-design component, and a sharing component. The learning, it was either didactic or maybe it was a more interactive kind of tool that we used, like a quiz. Co-design, we actually started to develop certain tools like the research framework and the toolkit, and we would have prototypes that we would actually work with and co-design in the sessions. And then there's a big sharing component, so either sharing after the meeting with their peers or sharing to each other within the session. And so these were types of the engagement approaches that we use. So maybe some of you have heard of the Kahoot quiz. We use our values to sort of anchor the meetings oftentimes. We had interactive games and activities. Some of you may have played the Marshmallow Challenge. So we did that. We had inspirational quotes, we had external speakers, and we also had an online collaboration site and used videos. We also had different ways of gathering feedback. So we developed prototypes. So this is a prototype of the card deck tool, which is actually a glossary tool. So we had lo-fi kind of prototypes that people would work with and get feedback on. We had stellar champions who actually created their own ways to gather feedback. So in this case, our administrative assistant actually in strategy, she developed this game where people would be able to provide her feedback on these glossary cards. And then we also had a meeting feedback survey at the end of each meeting. And this is a really interesting example of gathering feedback, but we actually had a Jeopardy game around research at our Learning Together conference. And so just some great feedback from the team. I'll just go to my favorite quote. This meeting is the highlight of my month. That's pretty powerful, right? So in terms of a culture shift, and I'm not sharing with you the data from our feedback surveys, but people were overwhelmingly positive about this experience. There were a lot of great takeaways that people had. They really moved the different tools that we developed forward in the meetings. And overall, there was just an overall excitement and exuberance at each meeting that was just phenomenal. They just, it was such a stellar group that just made me want to sort of plan that next meeting, right? So definitely they found value in the meetings, and we're excited about that next one. Lovely group. Okay, so what were some of the things that we did around processes and resources? So we set up the research committee, and there's Delilah right there. She's part of 7 people on the team. And again, the role of the research committee is to promote the partnerships around research and facilitate the learning. So they were instrumental in providing feedback on the tools as they were being developed by the research champions, but also look for opportunities to do more communication around research and support student research, for example, but also in the evaluation of research requests that we were receiving as well. So we do get some doozies now and again around research projects that people want to do, and we have to see, does it really align? Is there a way that we can actually help support these researchers? So the research committee was instrumental in doing that. And these are some of the stats from this past year. We had 14 research queries. We developed 3 letters of support. We helped co-develop 1 grant application. We did 1 expert interview, 2 research data requests. 2 projects were actually approved and funded for research partnerships. And we had 6 research requests. So that was once our process was established. This was actually through our research request form. Probably for you guys, not, astounding numbers, but for us, this is actually pretty good. And so just a little bit around the framework and toolkit. So this was an early prototype. So this is what I developed back in the summer last year to start that conversation with leadership around what we were trying to do. So again, this is not what we ended up with, but it was a helpful prototype at the time to get people thinking about what we were hoping to do. And so we ended up with 2 documents that you have on your chairs, and hopefully you take them away and you look at them in detail. If you have any feedback, please contact me. I would love to hear it. And they are stated still as draft. They're going through 1 last round of review before they're finalized, but they have a lot of really interesting aspects to them. So the framework itself was really around if you're a researcher and you wanted to approach the LHIN to work with them around research. What are some of the ways that you could actually do research with the LHIN? And so we wanted to spell that out very clearly, how we could support research through the LHIN. It also addresses why are we even trying to do, work around research, and what are some of the guiding principles that we use, and what is our decision-making process. So it kind of lays all that out. It's a very short read. I think it's only 8 pages. 2 of them is like cover and cover. That's like 2 pages. So that's really just 6 pages. So it's really short. It's written in a way that hopefully is accessible. It's really just one of those things that if someone wants to know what the process is, they can go to it, read it, and be done. And so again, these are 4 areas that we can support research. So we're definitely wanting to endorse research. So this is through letters of support, whether it says a knowledge user or other. Supporting research. So, can we navigate them to the Institute for Better Health, for example, to know what other supports are available, or just navigate the process that the LHIN undertakes, for example. Participating, so again, we do direct patient care. We also, run a lot of programs and those types of things, so we can be a participant in research as well. And also partnering. I think that's the biggest category for us, is partnering on research projects where we are providing subject matter expertise or analytical support, being on an expert panel, steering committee, those types of things. And so the workbook and toolkit is a separate document. And this actually came out of a conversation in the research committee where I think it was Dr. Robert Reed said, hey, this is great information. And he was talking about some of the information that we were providing in the curriculum for the research champions. But he's like, we actually need this for people who want to engage on research overall. So can you just put that together, start to finish, help people go through the research process? And I was like, oh my gosh, now I have to take all the stuff that was presented in the research champion meetings and put it into some sort of compilation. And it was an interesting time to sort of wrap all that information up into sort of a succinct document, but I think it turned out it's probably the piece that I'm most proud of in terms of what we collectively have been able to do as a group. And so the research champions were instrumental in providing some key ways to actually create this document. So they personified that non-expert perspective, and so they helped us really think through what is the type of content that they're interested in, how should it be communicated, so what is the type of language, the tone, how can we start to make it a little bit more accessible using characters, color, different types of fonts, using wayfinding icons. They were all about creating structure and wayfinding and those types of things. They said that's really critical when you're trying to learn something new. Also having the headings as questions, prompting people to actually follow the content. And then what was probably an aha moment in one of the Research Champions meetings was actually having these activities around graphics. So someone says, why don't we just write the question in a light bulb? And I was like, that's so crazy. Just having something that was so visual but also so informative. It's just something that really makes you want to use the tool. I thought was really important. And also in terms of the way it's presented, we want it to be both print and something that could be used digital. And so this is what it looks like. So I'm not going to go into great detail, but I just wanted to show one last tool, and that's the card deck tool. So this was something that we actually started the Research Champions meeting with. We started with a mind mapping exercise where I gave them a list of like 150 terms, and I said, which term are you most familiar with or you think actually links with another term? And so they started with maybe research as their key term in a bubble. And then they started linking to other terms that they connected with that term research. And so based on that initial exercise, we started to build out terms that they thought were really critical for the research process. I, of course, had executive decisions on which terms actually ended up in the toolkit, but this is the tool. It's a card deck that you can have on your desk, and it's called Improvement Terms Explained, and it's a glossary tool where you actually go through and you can learn about different tools, or there's different categories, sorry. So what is population health research? It has a brief explanation. What is patient and family engagement? So it goes through a lot of key terms that are important in research. So I have a few, not a lot, I have a few up here at the front. So if you're interested in taking one away with you today, just let me know. And so just to wrap up, sorry, I know I'm going over a little bit, but I hope this sparked your curiosity around research with the LHIN. And I know, again, you might not have thought about how the LHIN could be involved in research, but hopefully this is, expanded what you thought was possible. And is there an opportunity for you to work with us? And I think we would love to collaborate more and to learn about what types of research that you're doing. If you want to come present some of the work that you're doing at the LHIN, that would be fabulous. But yeah, I think I'll just end it there. So thank you so much.
Thank you so much, Vani, for joining us and sharing the work that you've been doing in the research and innovation and improvement space within the LHIN, and being able to demonstrate how both partnerships and collaboration and co-design has been able to work, how it has been able to be beneficial in the environment and the culture that you've led in the LHIN and the working relationship with the LHIN and THP and other community partners. We have some time for a few questions. Does anybody have any questions for Bonnie about the journey, the research and innovation journey at the LHIN, or anything that she's discussed and presented with us today?
There has to be one question. Yes?
So we have the draft version. When and how can we expect to see the final? If we want to share it and spread.
Yeah, that's a great question. So it's just going through one final review right now. Delilah is going to go through it one more time with what fine-tooth comb. No. Delilah's already provided wonderful feedback. But yeah, it's going through one more round of just final review, and then it will be provided on our website, but I can also share it with Delilah to then send broadly as a communication out. That works. Okay, great. And I really do hope that it's something that you feel comfortable sharing and are excited to share. One of the things that we were thinking about when we knew health system transformation was afoot was, where would these documents live once, sorry, it's okay, once that transformation did take place, right? And we were so excited about this tool that was developed in collaboration with, 34 staff, right? So we would love for this to live on at your organization or with your partners. And so if you do see an opportunity to share this and have this get spread, we would love you to share it. Yes.
Beyond sharing, can we use it?
Yeah.
For instance,
That's an excellent question.
I do a lot of research with non-researchers, like clinicians and things, and I think this is an excellent tool to kind of help us guide the process, like what can we do for you, how can we think about this together, and especially because you've developed it with so many different stakeholders.
Yeah,
Thanks for
please
sharing.
use it. And I think we did try and create it as broad as we could. So we did a number of spotlights in the workbook as well. So one spotlight is on the Institute for Better Health, but it's really talking broadly about, institutes that actually help support research. So a number of these institutes have similar support functions, and so if you're not in our LHIN, for example, or you're not, or don't have a collaboration or partnership with IBH, there might be an institute in your area that you can actually tap into. So I know, for example, at Baycrest, they have a research function as well, and I think it's through CABI, but they have a lot of research supports there that are very similar. And so I think people, as long as they know it's out there and it's possible, I think then they start to ask those questions. Yes?
Thanks so much for the great talk, Bonnie. Can you just tell us a little bit about what's coming up, what's next in terms of this type of work?
Yeah, and it's an interesting time. I think we were really thinking critically as an organization regarding what future investments we want to make. And I know that knowing that research and innovation is likely to be something that will be either under the Ontario Health Agency or maybe a particular role within the Ontario Health teams, we probably won't continue as a LHIN to continue some of the research investment. I think the research investment that we've done to date has been wonderful, and I think we've really empowered our staff and given them certain tools to think about research in a different way. But in terms of continuing the investment, we might do a bit of some knowledge translation activities in the fall, but I don't think we're going to be doing a big investment, knowing that we're kind of waiting for the decision to actually be made around these other organizations being formed.
Thank you once again, Bonnie, for joining us.
Thank you.
Yeah, one of the things that I'll also say, because I have been involved in the work that Bonnie has been doing, one of the things that I really love about the approach that Bonnie has led and the LHIN has taken is not only empowering individuals, but empowering individuals to also be those champions throughout the organization. So that sort of hub and spoke model that I know our own ethics program uses, and I think we can learn a lot from those approaches in the way that we ourselves enable and support research here. So thanks again, Bonnie. For those of you who have not yet signed up for the IBH distribution list, there is a sign-in sheet at the side of the room. You can find out through being added to that list. You can find out more about more of our events, as well as our next IBH speaker series that's going to be taking place on September 26th. Dr. Andrea Frolick will be presenting on implementing an ecological model of resilience for high trauma workplaces. More details will be sent out about this event as the event approaches. So thank you all for joining us and supporting this initiative.